Hi, I'm going to talk about timed observations in the clinic setting. So what does it look like? How do we set it up? And what's involved? So when we go and approach conducting observations in a clinic setting or any other setting, what we're doing in terms of the Lean Six Sigma methodology is we're walking the Gemba, right? We're going to the Gemba. Well, that's where the work is conducted, right? That's where the process occurs. And when we're doing so, we're looking at noting the process steps. And the reason we're walking the Gemba and conducting timed observations is really to clarify or update the process steps. And we're also looking to update decision points in inventory. Where is their weighting going on? And we want to keep track of forms and documents that are used and opportunities for improvement, utilizing the steps of the process map as well as the timed observation forms. And as you can see on the slide, we want to utilize post-it notes, right, for the steps so that we can clearly understand each step in the process. So that's the purpose of the timed observations. Some of the key questions as part of our data collection plan and timed observations is, for example, what are we measuring? Why are we measuring? What are we measuring? How will we gather the data? Where will we gather it? When and how often will the data be gathered? And who needs to see the data? All these are important questions to answer as we prepare for timed observations. And so now that we have set up the timed observations, we've coordinated and arranged for the timed observations with whomever we're working with, the team members. Here's a recommended approach because it's very important that we approach this in the right way, right? We're coming into someone's workspace or multiple individuals, colleagues. How do we make sure that we're doing it very thoughtfully and very carefully, right? We're guests and we're coming in to look over their shoulders and help them. So first of all, we want to make sure that we clarify what is the purpose of our observations? Why are we there? Make it clear to our audience, we're there to observe, we're there to learn. And we're very importantly, we're not there to watch them or judge them, we're there to look at the process and help clarify the process. We want to gather data and confirm process. We're not focusing on the person. And then after we conduct our timed observations, we want to provide feedback and share information and ask questions of the team to clarify what you've observed. It's an opportunity for them to really step up and help us understand what the process is like, each of the steps. And if possible, after we complete our observations, we want to share with them what we learned and the outcomes. And another technique you could utilize to really help them feel more comfortable, the teams we're observing, is to ask them what they observed and what they thought of the visit or the experience. So now that we've set up the timed observations and with the teams, we want to focus on, okay, we want to have a be able to visualize a system or process, right? And here's what a timed observation form, this is the THT standard, the new standard timed observation form. So we want, the purpose of the time observation form, it's really a tool for tracking and studying process steps and measure each of the steps cycle time. In this case, for example, you have 10, this could be 10 patients if you're in a clinic. And what we would do, for example, is for patient 1, here where my cursor is, we would indicate the start time. And then how long does it take for this particular patient? You would document each of the steps going down from the column with patient number 1 and add those up to a end time, right? Cumulative time. Then we would say, what is the time, total time here for one observation? And regardless of whether we finish 2 observations or 10, we would want to summarize the total time for each observation here on this route. And when we want to get to, you can either do it, calculate average time or mode or median time, cycle time. We want to understand for the observations we conducted, how long did it eventually take? Some helpful tips as we complete our observations. Watch a few times and agree to a standard set of steps with the same start and end triggers for each observer. And we want to focus on using the lowest repeatable cycle time for each step and most frequently occurring, which is the mode. So this tool, the time observation form, can be used to help identify value-added steps from the patient or customer perspective. And these are utilized, the data and the timed observations are utilized to populate our value stream map. So I hope this was helpful to provide context, and thank you for listening.